So good afternoon, everybody. I'd like to give me a great pleasure to be here today. I think it's a wonderful initiative, to come and to be on this place. My name is Letitia Pinto. I am a physician, child neurologist. I was going to notice by my accent that I was not North American. So I'm originally from Brazil. When I came to this country, I redo my whole training child neurology, and I had a chance to learn more about epilepsy. So since then, epilepsy has been my passion, and I think it's a wonderful opportunity to be here. And so the idea would be to speak about epilepsy in adolescence, and let's get started. I thought I would have more teens in the audience, and I think the big message is about and I noticed a couple of times when you deliver the diagnosis for a new onset of epilepsy in teenagers, I'm pretty sure they feel that they are alone on that moment. And I had the impression that, why with me? What's happening to me? And I think the first message is exactly to transmit to our kids, and they are definitely not alone on that. So who has epilepsy? So by definition, it would be anybody who would have recurrent unprovoked seizures. And the majority still have no apparent cause, particularly the teenagers, the new onset of that. The incidence actually is mostly during childhood. So we know, particularly from the meeting from this morning, the importance of this particular condition during childhood, because most of the epilepsy syndromes and the whole situation from the immature brain, it tends to have more seizures for other circumstances as well. So it's absolutely more the first year of life, and all the way until 10, I would say. And then during adolescence, we still have another, increase of chance of having more new onset of epilepsy, and again, late peak in adulthood. So why this is so important, and I apologize that I did so fast, I didn't realize some mistakes that you might notice in the grammar, but let's keep going. So why during adolescence would be so important for us to pay attention? First of all, some preventable causes of epilepsy, such as trauma. Another is that there is, as I mentioned before, a peak of incidence of the idiopathic form of epilepsy tends to occur at that time. So they would be completely normal, like having normal life, normal activities. All of a sudden they have this diagnosis of something that happens to their body that they cannot control. And this is called epilepsy. It comes everything along with that. So mesial sclerosis, even though it could be a condition that starts during childhood, became more declared as intractable epilepsy, medical-resistant epilepsy, exactly during the adolescence time, and which is very important to make a decision about procedures such as surgery and other form of treatment. And again, some rare form of progressive epilepsy can occur during adolescence as well. So unfortunately, we could have those rare forms of new onset of seizures, and everything kind of falls apart for those patients. And again, because of their age, you still have some special concerns, right? Some of the good news could come to the fact that during the teenagers, some of epilepsy would outgrow, right? So that would be the good news. So if they have been having seizures during childhood, they might have a chance during this time to outgrow. But by the other hand, some still benign conditions would have a long-term commitment in terms of treatment as well. In terms of what happens with epilepsy when the epilepsy grows up, right? So as a critical form, there's a critical moment in their lives because of this whole body transformation. Adolescence per se is already the whole new deal, particularly to get something else in the top of that. And they perceive for sure epilepsy as a barrier for them to achieve independence and a lifestyle of a normal teenager. And the one thing that I'm going to focus a little bit more would be exactly the compliance of the treatment. It is a huge problem during the adolescence. So another thing that I found very interesting is that the impact of epilepsy during this particular moment in life. As we know, we're going to discuss more with Stacy about this whole association of low self-esteem, social adjustment, depression, obsession could be more seen associated with epilepsy. And however, the very interesting that the level of epilepsy knowledge, so for example, what's so important, something that's happened right now, as much as you know, it is proven by studies, less impact of those comorbidities. So again, I think just to bring the idea how much we should encourage our teenagers to understand more what's going on, the parents more and more in terms of information will help certainly. Continue about the concerns about this whole new body, right? As I mentioned before, this whole special moment in their lives. In some of the long-standing epilepsies, who during that part, that transition, they start having more breakthrough seizures. So medications that was working before, they no longer working, and what's going on with that? Is it possible? And then during this time also would be important to kind of keep tracking, because there's a possibility might have to revise the whole treatment, and also may need more laboratory workup, because compliance is really, really important. The part of the levels and the lab workup is to make sure they are taking properly the medication. So another thing that I found very interesting is that the impact of epilepsy during this particular moment in life. As we know, we're going to discuss more with Stacy about like this whole association of low self-esteem, social adjustment, depression, obsession could be more seen associated with epilepsy. And however, the very interesting that the level of epilepsy knowledge, so for example, what's so important, something that's happened right now, as much as you know, it is proven by studies, less impact of those comorbidities. So again, I think just to bring the idea how much we should encourage our teenagers to understand more what's going on, the parents more and more in terms of information will help certainly. So adherence to the treatment is a very, very important thing globally. That would be most of the chronic conditions. That would be Crohn's disease, would be diabetes, would be absolutely everything. We have this problem. We know that this become like a huge problem in terms of the whole health situation, because of the poor outcomes would come with the poor treatment. So we know that we need to keep tracking as well on that particular aspect. And then again, effectiveness. So for example, we keep doing trials and trying to find medication, but if you just take it correct, might be the right answer. So the whole impact that the poor compliance can cause in general. So the whole transition between like young adults and our teenagers in that sense is the fact that the caretakers or caregivers are no longer in charge completely, so they need to take some autonomy from their own situation. Stressors of adult life interferes as well in terms of, because I keep saying to the teenagers that I see from all different reasons, like life's just going to get complicated from now on, so it's not that it's going to get any easier. Again, some of those chronic conditions can have other associated issues, such as we're going to see more in epilepsy, depression, self-esteem, or all the other conditions that can be associated. And we're going to also discuss that how much the impact of the epilepsy could occur in the cognition, executive function, in their physical, particular side effects of medications, and perhaps leading this to a decrease in dependence, which would be exactly the interface between the parents and the teenagers in terms of like to trust them more and kind of create more mechanism for this independence to occur. And then there's also some results from studies about what would be the most common cause. Again, I thought I would see more teenagers here just to bring them to the awareness, but important. So most of them would be simply forgot. They simply simply forgetting to take the medication. Is that's true, and we see this a lot because of either. I remember seeing a video of a teenager. It was interesting because it was in a conference, and so there was this huge, I would say, prolonged clusters of myoclonic jerks because of juvenile myoclonic epilepsy. So and then I remember somebody mentioned, but it's written 4 p.m. And typically we see GME myoclonic drugs upon awakening. And then in the video, the kid said, I don't know, I just woke up. And so it was 4 p.m. and he just woke up. So he literally like sleeping through the morning dose, the night dose. So those are the things we see. And then I remember that everybody's like, oh, of course, 4 p.m., but it doesn't matter, it's a teenager. So if there are other issues very important about like not poor compliance would be like if the child is away for all different reasons, either because it's vacationing or it's sleepovers, whatever would that be, the possibility would be poor compliance can be on that. If they are busy and just, again, goes and forgets. I just wanted to call the attention for not keeping down. So, for example, have some difficulties on taking the medication. So sometimes, in general rule, I can just give you some advice. If somebody vomited or threw up a medication within 1 hour of that you just gave the medication, just give the whole amount again, because likely it's going to need the whole package again. It's just, there's nothing in books and everything, but it's an important message to deliver. Some changes in routine. Another issue that I found, particularly on the benign epilepsy, is to feel too good. Because I don't have seizures for the past like 2 years. Why do I need to take that? Particularly in benign forms of epilepsy, that you have a long-term commitment of that with that medication, so you can remain seizure-free. So this situation can actually, I just feel too good, I didn't feel I need it anymore, and then you can have breakthrough seizures or full compliance. Another issue that's call attention, could not get the meds. So I cannot remember how many times you get called from absolutely everywhere. Like from the Caribbean parts, from Florida, we just came to vacation, just forgot our medications. Can you send us prescription all the way there? Yeah, of course. But that would be important too. So, and then again, I think the whole epilepsy as a concept is not only the seizures, right? The seizures, I think, is a huge component for the teenagers. We can talk more about that as well. But again, is in the middle of what would be emotional problems, social adjustment for them, and cognitive dysfunction. So all the aspect needs to take into consideration for when you talk about epilepsy. This is one of the things that I found more, like all the time I hear this from patients, I keep thinking that's the most striking things, the unpredictability of the symptoms. All of a sudden you have no idea what could happen to you. So you can just have a seizure when you're in the mall, when you're in the movie theater, when you're on a first date, in your prom. So I think this unpredictability of the basic nature of the epilepsy, I think it must be the huge stressors, particularly for teenagers. And for sure, some of the things in terms of the family system, because of that situation, overprotection is something that you can see sometimes, high prevalence of psychiatric problems that may, and another thing is like this, sometimes from the whole genetic aspect of epilepsy and also some emotional, like mental health that could go among the family members, this can also contribute for more and more pressure to that teenager. Communities the stigma of having the diagnosis. I noticed this a couple of times, for example, that even though it's more and more people trying to speak out about epilepsy and awareness, and that is still a very important issue in our society. And other societies can be even more impacted. Actually, yesterday I was talking to a friend of mine, she's a fellow in Boston Children's Hospital, and she was telling me that her mother is a teacher in another country. And she was telling me, now I'm discovering some of my patients, my students, they have epilepsy, but they don't want to talk about it. They kind of hide information. And it's very important, for example, in our teenagers when they transition from high school to college and they don't want to tell anybody, they feel like they don't want to start fresh, they don't want to say anybody. Sometimes I keep advice, I think your roommates should know. We're going to discuss about that, about how to advise them, but certainly, to start breaking, this whole social stigmatization of the condition. Another thing is like this, is to face sometimes even like low expectation from people that you should be the first one to encourage you, such as teachers. We know how much of the barriers we face with the school system as well. And then for sure, activity restrictions. We're talking about driving. I heard the person was just mentioning during the whole driving legislation. So how much has changed through time, to achieve better. But still, we still have those issues. So I have patients that they would come like, oh, just give me everything. I cannot lose my license right now. It's so important. And again, some of the issues that I face, the transition between epilepsy during childhood to adolescence would be exactly that. Sometimes they say, I cannot afford to lose this kind of autonomy, I cannot lose my driver's license, so I wanted to continue medication. Or even want to know if I already outgrow my epilepsy anymore. So it's part of quality of life. So sometimes they don't want to run into those issues. And again, it's their decision. So things that I found a couple of things we're going to discuss here, and I would love to hear what also you have to say about your experience, but that would be on our website from the Epilepsy Foundation. So for example, things such as, I'm afraid that my friends will find out that I have seizures and they'll make fun of me. So exactly part of this whole stigma of the disease. So obviously it's going to come from the child or the teenager, who they would like to tell. And for sure, it's very hard to hide from your best friend, from people that's with you all the time. So I think to encourage them, to speak out and see, and for sure advice for those friends that you think, oh, you know what, you might be right, maybe that person specific should not know for some reasons. It would be always like as a common sense, how you would advise them to proceed with that. And what's proven so far is most of the friends will understand, will cope, would like to know more, would like to know how to help. That's some of the physicians' experience. And I had already patients that would come with the best friend to the appointment, which actually I have exactly this picture about the boyfriend versus girlfriend, to invite them to come to the appointment. So the relationships kind of getting serious, they kind of care for each other. Why don't come to the doctor's appointment, can hear about seizure precautions, about what's going on with the seizures, side effects of medication, so can understand more, can help more. And I would say this would be for absolutely every mother and father that would have teenagers. That would be our main issues about, and again, drugs and alcohol is not good for anybody, anything special. And I remember, even back in Brazil, I would see patients that would stop taking the medication so they could drink, because they don't want to mess up with it. Would be just a perfect combination to get seizures and all the other problems. And I remember there was one of the nicest case reports. We were discussing about, actually it was during a visit that I had, a trip that I had in Australia. So I was in a meeting for epilepsy surgical conference, and they were presenting this case. And I think because of the culture there, one of the things that was written that the girl really wanted to pursue epilepsy surgery because she wants to get drunk. So she really wanted, it was written there. It was an inability to get drunk, so she really wanted to get the epilepsy out of her way so she could potentially drink. And I remember somebody in the crowd said, so maybe we should not operate her, let's leave the epilepsy right there. Where is it? So, but anyway, so we deal with the significant issues. I didn't specifically put anything about medical marijuana here, but again, I think the wrong idea that, or maybe the good idea is everybody's talking about, how good marijuana is for seizures, so should be something for me to do it. And again, I think the big message, let's wait for the studies. We know that there are two major components of marijuana. One is good, another one is not good. So it's kind of advice is not like that. So we need to, and again, we need to see the facts and go from there and do the right thing. And again, a lot of big issues about our girls in terms of getting planned pregnancy, because they can have healthy children. They can have everything they want, but needs to be planned, needs to be organized. And some of the medications, which nowadays with so many good options, we try to avoid, but like Depacol, rarely we see using in girls anymore. But again, it would be something that requires supplementation, and very important, like prenatal care, before you go that route. And I remember seeing advice about this, pregnancy is the best thing you can get from unprotected sex. So meaning protected sex would be good, all the circumstances, all the other reasons. So, but it's important to mention that as well. I believe Dr. Barbara Jost will talk more about the whole catamenial epilepsy. But again, during the adolescence, And I have some cases, they start noticing that the breakthrough seizure would occur around the area of the menstrual cycle, either a little bit before, right in the beginning, and it could be related to estrogen. They don't know exactly how is the mechanism of that. It's not all the seizures that would be actually matching that profile. It's also always a good idea to keep matching and see if you can bring these. There are some strategies you can do, to help out with the treatment for seizures that would be exactly occurring around the menstrual cycle. And again, to promote more, I just a slide that became a little bit lost in my talk when I was thinking about that. But some of the strategy to promote some positive impacts, that would be for example, our duty as a providers, to create positive impact in the seizures. Side effects of the anti-epileptic drugs, try to find the best combination that we would avoid side effects and to promote better seizure control. Offer possibilities such as surgery. So I remember seeing patients that has tried surgery in the past, they failed as a candidate. Nowadays, they change so much the way they see, the seizure focus, the epileptogenic area zone, and how can approach that. So, particularly if somebody has a profile of having always the partial seizure, always the same way, never change, just have one single type of seizure, seem to be always coming from one specific area. Even it's called known lesional case, they should always discuss with the doctors, is there anything new about that? Given the possibility. And again, all the strategies such as diet, BNS. Ketogenic diet for teenagers is very, very complicated. So I remember this mother, she was always positive, and she was having this boy who had a very, very bad type of epilepsy, and he was trying everything. And all of a sudden she said, you know what, I want to try the diet. But he's already 14. He would be actually 15 because it was freshman in high school, so pretty much 14 to 15. And she said that one day she went to pick him up, so he wasn't ketogenic, that came with a milkshake. What's up, Mom? And she was really? So she had no control about what he would buy, what he would drink, what he would eat. So, and then she gave up on the ketogenic diet. But anyway, some other options that we can always help. And so, as I mentioned about, and I'm sure you may have heard from Dr. Morse this morning about why to consider epilepsy surgery. And again, because of some of the epilepsies can become refractory. If they fail, most of even the alternative type of treatment and surgery would be a good possibility. So it's important to always and very interesting, that girl, she was at that time 16, and she was all about her decision. Mom, there wouldn't be any. There needs to be there. Another very important issue would be, for example, there are some focal areas that involve the area of the visual field, and we know from drive situation that once you have your visual field cut, you permanently cannot have drive license. So for somebody to make a decision, even at the age of 8, I'm going to remove the occipital lesion or some area that's going to promote afterwards a visual field cut. Can we make clear that you cannot drive, and that's something that you would be okay with that? So those are the things to consider. And some of the parents I heard later, they would say they wouldn't be able to drive with such a bad epilepsy anyway, so they end up getting this issue. But anyway, it's a very, very complicated topic. And then this whole effect, for example, there is some list about what exactly the epilepsy can disrupt it or not, the cognition, the intellectual ability. And for sure, some of the generalized epilepsies that has no cause whatsoever, you can have somebody with completely normal IQ, and it's very rare to see such patients having decline in their IQ. However, we have other circumstances that we can see that influence somehow their, for example, the intellectual abilities and how they can contribute to have their best academic achievements and all the other skills that they can learn. So we know there are some influence about that. So let's just so I again just mention about we don't expect some of this generalized idiopathic epilepsies to have a decline over time in their IQ. For sure, we have also some sort of more malignant type of epilepsy, which we know more about encephalopathy. So we know they would have some disruption on their connections in the brain associated with the seizures. The So studies have shown that, for example, intellectual disability is something that can occur in a population with seizure disorder. And more importantly, in patients when you have some other concerns that the seizure is just a part of something else going on in their brain, not only the seizure is just a manifestation of something else. So that would be another thing to consider. And then in terms of developing skills, so what's said about the way the brain responds, there are some different kind of connections that when you start learning a skill, and then what you need to establish that skills in your brain so you can use again and maintain that. And so for instance, there are some skills that actually the one discussing about this topic with a friend of mine who is a neuropsychologist. She said the same as like learn how to drive. You can learn, so it's kind of a new emergency skill, right? And you use specific connections in your brain that different connections will be used later on to establish that skills you learn. And then once you continue to practice, you maintain that, it became a completely different set of places in the brain you're going to retrieve that information from. So it depends on exactly the amount of, for example, either a lesion or the extension of seizures, of seizure focus. You can have issues on those steps, and that's why you can have problems with the new skills. Some of the skills, if they are learned after a new onset of epilepsy, depends on the type of epilepsy, of course, they would continue to be established and safe somehow throughout adult life, but sometimes you can interfere with the new skills. If you have like a new onset of an epilepsy, depends on the cause, you can interfere with that new developing skills. I hope I was clear. Right. And then again, I think some of the things are not yet 100% understood in terms of how much impact you can create. So, for example, you can have focal lesions that can be a focal lesion, focal problem, either in your speech, in some specific areas. However, focal lesions, depends where they are, they can promote diffuse problems such as attention, executive function, regulation of the mood. So sometimes you're going to see things that is related, it seems that there is a dysfunction somehow in the brain on that, in the brain connection. Coming from just that little area, that over there, that's having the seizure. But why is that? Because of the way it can disrupt those connections. In the same way, generalized disruptions can cause specific focal issues. And you know that about like language and Landau-Kleffner, for example, something kind of well known. And again, talking about academic achievements in terms of situations such as the school absence. Somebody's like having very active seizures are poorly controlled, they end up having issues in the social aspect and achieving better problems. Learning disabilities can occur more often, as well as we discussed about, and not only like intellectual disabilities, but specific learning disabilities. Attention, the impact of the seizure medication. So I remember, for example, I never believed that Depakote would cause such a cognitive impairment until I met a kid who came to like a video EEG monitoring, and they have to remove the medication. And the mother said, I don't want this medication to go back because we wanted to see the seizures. So we stopped the medication, let the seizures come, so we could monitor, you can see where the seizure is coming from. And the mother noticed like she never realized how much that medication specific was impacting his cognition. So I'm not, and again, I should have said this in the first slide, I'm not working for any company, I have no disclosure. I mentioned the Depakote a couple of times, it's just an idea, but I believe that's one of the best anti-seizure medications we have. Unfortunately, we have side effects, it's not the only one, that's for sure. But I'm just mentioning that because it was something that caught my attention. I never believed somebody would say, oh, but I noticed some difference. I said, oh, really, do you think? But you always keep thinking, but I don't know about that. So then once you see, like, once we remove it, this person was completely different from the attention and cognition and participation. Factors, as I mentioned, associated with cognitive decline, anti-seizure medication, difficulties to control seizures, status epilepticus, if they start developing, like that's one of the things about being compliant and avoid prolonged seizure. We know that status epilepticus are more common in patients with epilepsy. So if they have epilepsy, they will likely to go into a status rather than somebody else that's just starting their new seizure activity. So they're important to know, and that's why the compliance is so important. they mentioned about early seizure onset, but it's not. Some studies have shown if you have early seizure onset, you increase the chance of having cognitive problems, but it's not what we're actually experiencing on a daily basis. It can be different, that specific correlation. And for sure, if you have a reason why you would have an epilepsy, a lesion, or it is more like a cause or epileptic syndrome, that would come with a more complex outcome or prognosis. And I think Abby is going to cover more about the psychiatry aspects of the epilepsy. But I just want to mention that among most of the other chronic conditions such as Crohn's disease, diabetes, renal insufficiency, epilepsy is the one who carries the most common comorbidities in psychiatric issues. So I think it's a very, very important that aspect that we discussed. And again, it's typically would be for most of the parents here today would be like a long life trajectory, and this whole situation about how we will do transition. So now more than ever, people are talking more how can we transition care, how can we plan, how can we promote better transition of this particular age, which is such an important thing, to help them to develop their executive skills, regulatory capacity, social skills, and how they're going to create better adjustments for this transition into a young adult. I don't know if you can read the joke over there. Is exactly, most of the times in the epilepsy patients would be exactly the opposite. The joke is like, why don't you take a sports son, like a long distance running away from home? But it's just like now. But I think it's exactly the interesting thing about this aspect specifically is that there is no guidelines that would advise. They have several actually, but there's nothing structured that say how we should make the transition in terms of health care and all the other. This could be case by case, and we can have like general rules, general advices, right? But basically changing the whole family-focused type of treatment to more autonomous type of treatment. How are we going to carry this away? And again, always promoting ownership of the medical care, of medical needs, self-advocacy. I was hearing our guest next door talking about how important it is, and how to help them to self-advocate for their needs, and to create circumstances that would have the knowledge, the tools that they could go after what would be important for their legal rights, special educational resources, and everything else that would be important. Oh, and this is another one. So, good news, Mom. I was accepted to the college of your choice. So, and I think this is important, particularly in terms of the transition. And for sure, if the question is, can my daughter go to a college, the answer is most likely yes, right? And then how is the best way to approach that? And again, there's no specific guidelines. And in general, for example, to plan earlier, to see small or large settings, which one would be the best one for your child. How can you the whole learning process, again, advocacy with the professors, and in terms of educational plans, individualized educational plans, everything that can promote better establishment in the new academic settings. Also in terms of healthcare, right? Because they likely could go away for college. So what kind of resources around supporting groups, promote healthy style, particularly in the situation when you think about substance use, sexual relationships, diets, sleep deprivation. Sleep is huge. We know that for breakthrough seizures and peer pressure, how to handle those issues, and always using a team approach. And some of the things I thought about would be interesting for us to take as message. Always rely on what's out there in terms of research. So for the teenagers, that would be when you're thinking about advocacy, treatment, and what is out there, go by the facts. And sometimes a lot of things is in the internet, but no scientific proven and anything else. So that would be one of the things about the medical marijuana. Just let's wait to see what's coming next, and let's see what would be the best. I'll always rely on your adult of interest, the one that you trust, that you continue for good advice. Most of the time they will have good answers. And again, we promote more independence, family support. I think it's mostly co-adaptation in terms of cognition. We discussed this about. And I remember listen to the gentleman on the lunch hour as well, when it mentioned about you guys being the most experts. I was talking to Abby about that. So interesting that there is this very famous doctor. He described a disease here in the United States. He described the disease, he described the treatment, how to make the diagnosis. So he went to Brazil thinking that he was being the most the expert on that condition. And he met a mother who actually had a kid with that condition, who took him to the Senate and asked him to speak, to get the screening, neonatal screening, and she was talking to him, and he said, I came here thinking that I was the expert, and actually she is she knows so much more. And then exactly I felt the same way coming here today, just hearing, some of the things, and I become oh, I'm going to go there trying to teach something, and then you discover that, no, not like that. and I agree, and I think that even though people like me, in terms of physicians, I really like to study about epilepsy, I really like to treat patients with epilepsy, but I know that without the team, the family, what you can learn from the parents, you don't go anywhere. It's a kind of condition, there's a team approach, there's no question about that. All right, and I think that will be all I would have to say. And I remember listen to the gentleman on the lunch hour as well, when it mentioned about you guys being the most experts. I was talking to Abby about that. So interesting that there is this very famous doctor. He described a disease here in the United States. Any questions?
Would you say that the tendency for teens is to disclose now, or do a lot more of them not tell people that they have epilepsy?
So actually, my personal opinion is more out there to be more, because as much as again, the knowledge, you're more able to break the barriers and to kind of hide yourself, and even for safety. So unfortunately, I have this situation that happens when I was actually a resident in the hospital. The whole team went through this mortality meeting, and we have to go over quality improvement. And I remember I never saw somebody crying so much. It was the neurologist of this teenager who went to college and actually went to college, didn't tell anybody that she had epilepsy, and then had unfortunately, seizures that can happen in the dorm, and nobody was able to help. Nobody knew about that. She was in a locked setting and having a very bad outcome. She died on the dorm. So I remember that neurologist. She was devastated. Because first of all, she felt guilty because she never told the parents that this could happen. So this comes the whole idea about the SUDET that everybody talks so much about. And I remember she saying that her conversation with the parents afterwards is that she was always scared that if she would say that, they would never allow the girl to go to college because they would fear that something like that happened. And the parents, they would say the only thing we wanted to hear that there was a possibility. So actually, it's out there, even for the doctors, it's not easy for us to say. So when you have a new onset, I remember having first time appointment with patients. You guys come to a doctor with your kids having first seizure. You're so scared that you're going to see that thing again. You're going to start a new medication. You have this new diagnosis. And you don't want to hear the doctor saying that, by the way, there is still a possibility higher than the rest of the population that something like that could happen. Understand what I mean? So it's very, very difficult for it. For example, if you can imagine a barrier from a doctor to disclose the details of a condition, imagine for the kids to take this and bring along. But how much they know, how much they can protect themselves about it. And again, I think the overall idea is that the friends who you understand, the people that really matters and who really care, that you understand and help out. And I think for safety reasons, I'm very convinced that. And I remember listen to the gentleman on the lunch hour as well, when it mentioned about you guys being the most experts. I was talking to Abby about that. So interesting that there is this very famous doctor. He described a disease here in the United States.
I was asked to ask this question by somebody else. in third or fourth grade. They went away, but migraines began instead.
So
Is that just coincidence?
Say that again, I'm sorry. The seizure stopped and then what's happened?
It's migraine.
Migraine.
Instead.
Yeah.
Is that just coincidence in this particular case?
Yeah, it could be. Migraines are very prevalent, particularly during teenagers. We see this all the time. Could be coincidence. There are forms of epilepsy that is well recognized association with migraines. So, for example, there is one benign epilepsy during childhood called the paroxysmal occipital discharge associated with it. Though this type of epilepsy is very often associated with migraines. They can even have migraines and epilepsy, like seizures, at the same time, but can outgrow. Typically, they outgrow that epilepsy and can have migraines. So the answer is yes, could be, because it could be also sporadic because it's really prevalent, it's really common.